Okay, I am Professor Alessandro Inserra. I come from Italy, from Rome, and my institute is Bambino Gesù Institute of Rome, that is owned by the Vatican and is the biggest center of pediatric surgery in Italy and maybe also in Europe. Pectus Excavatum is a congenital deformation of the deformity of the pectus that in our country is not so frequent, but is a depression of the sternum in the middle of the thorax, the major of the cases, that is aesthetically not quite supportable for the adolescent and the children. Well, we used in the ears some surgical models and some surgical approach, like Ravitch approach, that was the first one described in 1950, and then the use of the bar, the nose bar procedure. The first one, the Ravitch one, is a very difficult surgery. Is very, very expensive for the patient because there is a big loss of blood and with a recovery that is really long. The second one that was produced in the United States from Professor Nuss, and he has an experience that more than 1,000 cases, is a good procedure. The problem that this procedure is done with a thoracoscopic approach, so you must enter inside the thorax. Pectus Up is a simple procedure, is completely external to the thorax, just an incision of 3 centimeters in the middle of the sternum, and you can put there 1 or 2 bars, in any case, symmetrical pectus or asymmetrical one, and there are no complications, so it's much more available for all the surgeries. Without pain, little pain, is rapid. You can exit the theater, the surgical room, with a complete correction immediately after the surgery, and there are no limits in the application also of any sport in the proceeding and when the time goes on. For this correction, I've done 100 cases of NAS procedure and 43 or 44 cases with this procedure, Pectus Up. And in any case, you can imagine if I decide to move my experience from NAS procedure to Pectus Up, it is obviously the simplicity of performing the surgery and the immediate results that you have. Because it's a simple technique, you have no blood loss. The result is immediate. You have not to enter thoracoscopically, so the cost also of the surgery are less because you don't have to put also the instrument for thoracoscopy, and it is more and more appreciated from all the staff in the theater, because there is no need of a lot of preparation before.